Hey, everybody. Welcome to this masterclass with Emma Green. It's so great to have Emma back again. And we're going to be talking about how shoulder weakness can give you tennis elbow. So I'm really excited to have this session for y'all because I've gotten, a lot of feedback about tennis elbow and the problems that it causes you. I've had it myself. Sherry, who we just did an awesome yoga workout session with, mentioned that she's had it as well. And so she'll be here. So yeah, if you don't know about Emma, she's done a lot of great work in this field. She's known as the tennis elbow queen, which is awesome. And so she graduated from Manchester University in England as a physical therapist and gained a master's degree in sports medicine. She's now dual qualified as both a licensed physical therapist in the USA and a physiotherapist in the UK, along with being certified in clinical Pilates through the Australian Physiotherapy and Pilates Institute. Emma has also traveled worldwide with many national sports teams and worked at the London 2012 Olympic Games. And Emma, I understand that big things have happened with your book as well.
Yes, absolutely. Thank you so much for this opportunity again, Mibon. This week has been amazing. I've been really glad to be able to catch some of the sessions live, but it's been phenomenal once again. But yes, so my first book, we're almost at the 2-year anniversary. So Tennis Elbow Relief, you can get it on Amazon. But it was admitted to the World Tennis Library in Wimbledon at the end of last year. So I was super happy to be able to be over there, to actually go to Wimbledon and hand over my book to be admitted to the World Tennis Library over there. So that was a very, very proud moment for me. I really enjoyed it.
Yeah, that's incredible. Big up, as they say in England, to you. Well done. So, I'm happy to let you just take it away. And, obviously people can ask their questions in the chat and then we'll kind of intersperse them at appropriate points. So, Emma, feel free to take it away.
All right. Thanks so much, Mivan. Yeah. So I'm going to start off by talking a little bit about tennis elbow, because obviously that is my specialist subject, if you like. That is what I deal with all day long, pretty much. And so the prevalence of tennis elbow within tennis players, 40 to 50% of tennis players are going to experience tennis elbow at some point in their playing career. So it affects a lot of you guys. It really does. And so what is tennis elbow? Tennis elbow affects the tendon that attaches the forearm muscles to the bony point on the outside of your elbow. That's called the lateral epicondyle. So you'll sometimes hear tennis elbow be referred to as lateral epicondylitis. That is the sort of medical terminology for it. Lateral just means on the outside. Epicondyle, that's the bony part of the elbow that it attaches to. And itis is inflammation. And so outside bony part of the elbow, inflammation is basically what that terminology means. But what we know about tennis elbow is it can last a long, long time, as I'm sure many of you watching know. And the reason for that is tendons are really, really stubborn to heal. They don't have a good blood supply, so it takes them a long time to heal. So when you get a problem with the tendon, you need fresh blood coming into the area, bringing the building blocks for the healing process. And tendons don't have that good blood supply, so it really slows down their healing, which is why it can go on for so long. So a lot of the strategies that we use to heal tennis elbow are basically to increase that blood flow. So I'm just going to backtrack a little bit and explain how that tendon heals as well. A little bit with regards to imaging and how the tendon looks. So if you have take a normal tendon and we image that, whether it's MRI or whether it's an ultrasound scan, if we look at a normal tendon, imagine a rope, because that's basically what a normal tendon looks like on imaging. The fibers are all very tightly packed together. Everything is very uniform. It's quite a short little rope. It basically attaches the muscle bulk that you have in your forearm to that bony part of the elbow. So it's quite a short little tendon, but obviously it can give massive problems to people. So keep that image of the rope in your head. Now, when somebody develops tennis elbow, which tends to be an overuse problem, it tends to develop it'll slowly start niggling along. You'll get it bubbling along before you even feel it. And then something happens and you feel it. It was probably bubbling along for 3 to 6 months before you even felt it. something was happening. So when I work with people, I always say to them, what changed 3 to 6 months ago? What was it? Did you increase your training? Did you change your grip? Have you changed your biomechanics in some way? Was it a different racket? How did you have your strings? What's going on? Something's different. So we look 3 to 6 months back, because that's generally the length of time that it has taken for the symptoms to appear. Now, it can be traumatic. It can be a fall to the elbow. That is much rarer. And there are other things that can cause tennis elbow to develop, or tendon issues to develop as well. But overuse is by far the most common. So that's pretty much what we'll discuss today. So if you do that imaging on a tendon that has tennis elbow, think back to that rope that's tightly wound. Imagine that rope unraveling. If you were to try and unravel that rope the wrong way, that's what a tendon that has tennis elbow looks like under imaging. The fibers start to come apart. It's not uniform anymore. They're not tightly packed together. Cells get in there that shouldn't be there. And that's what causes the discomfort. That's what causes the pain. And that's what slows the tendon down from healing as well. Now, in the olden days, back in the olden days, cortisone injections used to be sort of the first port of call for anybody with tennis elbow. The theory was cortisone is a very strong anti-inflammatory. Let's bring the inflammation down, and that will allow the tendon to heal. Now, any treatments that have been used in the past, whether it's cortisone injections, whether it's ultrasound, whether it's laser, whether it's whatever, about 50% of the people will improve and 50% won't. It literally is the toss of a coin. And we don't know who will and who won't. It is literally the toss of a coin. And so we didn't know why some people would improve and some people wouldn't, but it was just the way it was. If you did imaging of the people who didn't improve, obviously you would still see the degenerated tendon. You imagine that rope unraveling. On the people who did improve, you would still see that degenerated tendon. The tendon did not heal. So we could get symptom resolution. So the symptoms could settle down, but the tendon didn't actually heal. And that was part of the issue with the tendons. So now over time, we've learned that cortisone is actually not a good thing for tendons at all. It causes tendons to break down and degenerate. And even the action of putting a needle into a tendon is detrimental to that tendon, no matter what you inject into it, whether it's cortisone, PRP, whether it's vitamins, enzymes, whatever. Just the action of a needle going into a tendon is detrimental to that tendon, and that tendon will not be able to ultimately heal as best it can. Now, if you haven't had injections, don't beat yourself up. You can still heal, but it's not great for that tendon. It makes it harder for that tendon to heal. Now, there is new way of healing tendons. It's been around for 25 years, so it's not that new, but it is kind of the newer way. And that is to put a load through the tendons. You've got to load the tendon in order to heal it. They've done a lot of research on this, and we know that we've got to put a specific load, an eccentric load, through a tendon in order to heal it. And what it does, it starts to tighten that rope back up again. They call it like wringing out. Imagine like wringing out a towel. That's what it does to the tendon. And it helps to normalize that tendon. That tendon goes back to normal. Woohoo! We can't often say that in medicine, but that happens with that stress and strain going through it. So, there's a lot of information out there about, heal your tennis elbow in 5 minutes by doing this one thing. I mean, it's not going to happen. It's not going to heal the tendon. So you can get symptom resolution, and that's not such a bad thing. We want to be feeling better. We want to be pain-free, but know that you have to put that specific stress and strain through the tendon in order to fully heal it. Now, back in the day, even when I started teaching this program, which is almost 15 years ago now, we used to think tendons healed in 12 weeks. That was kind of the body of knowledge that we had in the medical field at that time. We thought tendons took 12 weeks to heal. We now know it's 12 months. More research comes out all the time, and we're learning more and more and more. And we know because tendons heal so slowly, they change so slowly over time, they need 12 months of that eccentric stress and strain going through it in order to heal it absolutely to its fullest potential and the best way that we possibly can. So know that if you are doing eccentric exercises, you're doing absolutely the right thing to heal your tendon, and you need to be doing them for a full 12 months. Now, that's not to say you're going to be feeling it for the full 12 months. You're absolutely not. Symptom resolution and feeling better and becoming pain-free is a big part of my program, and of anybody's program. We want you to be feeling good. And that can happen within 2 to 3 weeks. That can happen very quickly. But the tendon is still not healed. So the way I'm starting to sort of educate my patients now is like, imagine a big sheet of paper that has 52 little boxes on it, and however long you've been doing your eccentric exercises for, you can cross off a box per week. So generally, the clients that I see have been suffering, that most of them have failed PT before. Most of them have failed therapy before. They've tried it and it didn't work for them, and they're just, looking for the next solution. Generally, they've suffered for anywhere between 6 to 18 months is the general. There's some who find me a little sooner, some who find me a little later, but 6 to 18 months is generally where people find me. Within 2 to 3 weeks, they are generally pain-free, and with 10 weeks, we can be back on court. And so after suffering for 18 months and not being able to do anything, that's very fast. Now, and again, I say the words of caution. The tendon is not healed at that point. So we're still very cautious about doing certain things, but we want to put normal stresses and strains through a tendon in order for it to heal to its best ability, and normal stresses and strains of playing tennis. So getting back and doing certain things that are non-irritating is a big part of the program. So that's how prevalent it is. That's what it is. That's how to heal it, and versus symptom resolution. Now, some of you out there are going to be saying, well, I don't have tennis elbow, Emma, so this is great. How do I prevent it? And there is a stretch that you can do it's used to heal tennis elbow, but it's also used to prevent tennis elbow. And so I'm going to teach you that right now. You likely will have seen this stretch. If you Google tennis elbow, this stretch will come up, and you'll see it. People have their arm straight out in front of them, palm down. So I'll do this now. Come on, stick your arm out. If you're browsing elsewhere, come back to me. This is important. Arm straight out, palm down. You're going to take your fingers down towards the floor. Your other hand is going to go onto the back of your hand, and you're going to pull it in. Now, notice I'm not curling my fingers around. You don't need to do that. Back of your hand, pulling it in, and you're going to keep your elbow straight as you stay in that stretch. Now, I then take the arm down. That takes the tension off the nervous system. I'm going to be talking about the nervous system in a second, because we want that stretch on the muscles, but we don't want to be tensioning the nerves. So we're going to keep that stretch on. You're going to hold it for 30 seconds. So, it's a slow count of 30, or get your timer out. That is going to help to decrease tension in the forearm, which helps to take the tension off the tendon if you have tennis elbow. It helps to decrease the tension in the forearm. That prevents issues in the tendon developing if you want to prevent tennis elbow. So it's the same stretch for treating and for preventing. So that's for tennis elbow. Now, some tennis players develop golfer's elbow. Golfer's elbow is essentially the same pathology. It's just in a different place. It's on the inside of the elbow rather than the outside. Essentially the same pathology. The way we treat and prevent that, or one of the things that we use to treat it. Arm out in front of you. Come and do it with me. Palm up to the ceiling. Fingers down to the floor. Hand to palm to palm. You're going to pull your hand in that way. And again, bring it down. You're going to hold it in that position. And again, 30-second hold. So that would be for golfer's elbow. Now, if you don't have elbow issues, I would highly recommend that you use both of those stretches as your warm-up every single time before you play, and as your cool down. Definitely as you cool down. It brings the muscle tension down. It allows us to take the tension off the tendon, and it is going to prevent you from developing tennis elbow or golfer's elbow in the future. So definitely do those stretches. Now, if you need more help, if you do have tennis elbow, obviously you can get my book. This contains the framework to healing. You can get this on Amazon. However, if anybody upgrades to the VIP All Access Pass for the Tennis Summit, through my special link, I will send you a book for free. So, yeah, I know, right? So I think, Meban, do you have that link that you can pop in the chat for people?
Yeah, I have that. I'm going to pop that in a second. Yeah.
Okay. So anybody who signs up through my special link to upgrade to the All Access Pass for the Tennis Summit so you can watch all of the sessions again, which have been amazing, I will send you a free copy of my book wherever you are in the world. So you will get a free copy of my book. Now, if you are not in a position to upgrade, you can get my book on Amazon. It's on Amazon worldwide, paperback version or Kindle version. For everybody who has the book, there are book bonuses that go along with the book. Don't miss them, because these are additional videos that teach you the eccentric exercises that you need to heal your tendon. So the book gives you the framework. The videos are kind of like the meat on the bones, if you like. So don't miss out. There's a link inside the book. Sign up through that link. You get the additional videos that go with the book. All right. What questions do we have about tennis elbow? Is there anything up to now?
Yeah, for sure. And just to reiterate, I popped in the link to Emma's All Access Pass, with the bonus. So thanks a lot for offering that. That's super awesome. Appreciate that. Yeah, it's such a great, and it's cool to let's see. I had a comment here about, oh yeah, Dory said the book is great. I have it. So awesome. Great to hear that, Dory. Sweet, very cool. And then Tom said, saw Emma the first time last year on Tennis Summit. She's on point. I've treated thousands of tennis elbow and head of myself. I bought her book, Program Excellent. So
thanks,
love
Tom.
to see that.
Brilliant. Nice to see you.
Super cool. And then Mario has a comment in Spanish, which I think basically says good work. So yeah, thank you. Yeah, very nice. Let's see. So Gabriella, great to see you again. She was on our previous session with Sherry. Excited about this session. I have had shoulder issues, and when I was trying rackets a few months ago, I now have tennis elbow and golf elbow too. Tips on healing and how not to get it again.
Yeah, absolutely. I mean, that's a great question. So I mentioned the nervous system when we were doing the stretches. So Gabriella, both of those stretches are going to be important for you to do. The one with the arm out in front with the palm down, that is for tennis elbow. Palm up, that one is for golfer's elbow. So both of those are going to be important for you to do. Now, you're absolutely right. Shoulder issues, if you have any kind of issue around the shoulder, subconsciously, your brain is going to try and take the stress and strain away from the injured area, and that stress and strain is going to go elsewhere. And that can be a part of the reason that tennis elbow develops, which is why I'm going to talk about shoulder issues. With regards to healing, as I said, you need the eccentric exercises. You have to put eccentric exercises through tendons in order to heal them. So get the book. The videos that go with the book show you the eccentric exercises that you need to be doing. But definitely stretches before and after you play are certainly going to be helping. I touched on the nervous system. The nervous system, I have found, and again, this is something I have sort of found over the years. The nervous system is a huge component within tennis elbow. We always think of just this tendon. It's like it's by the elbow and that's what it is. But if you imagine a pebble dropping into a pond, and over time those ripples go out and out and out and out and out and out and out. Imagine that part of your elbow as the epicenter where that pebble drops. Over time, the ripples are going to go down here. And what we find is things further away from that epicenter start to become involved. And the nervous system basically does that. So tendons and nerves are very closely related, very highly correlated together. We sometimes see this with people who have Achilles tendon problems, develop sciatica. So tendon and nerve go together. 95% of the tennis elbow clients that I see, and obviously I see a lot, have some kind of nerve issue going on. It is very, very prevalent. And it's very often overlooked in rehab and can often be the thing that is not addressed that stops the tendon from healing. Because what happens is you get a hypersensitized nervous system because of where the tendon is. And so this is my theory. Because of where the tendon is, you've got a nerve that kind of just goes around the back there. If you've ever hit your funny bone, that's the nerve. And so you can see the tendon and the nerve are very, very closely together. If you've got an unhappy tendon that is degenerating, we've got, cells that shouldn't be there, you will have inflammation in the very early stages. it's very easy to see how that could then affect the nerve that is so close in proximity to that tendon. What happens when the nervous system becomes hypersensitized is, well, there's two things. The nerve starts sending too many messages to the muscles to switch on. So we get a tightness in the muscle. As the muscles get tight, that starts pulling on the tendon more. We get more pain. When we feel more pain, the muscles tighten up even more. And that's a vicious cycle. So we need to eliminate that, and we need to break that. The other thing that happens is, because the nerve is so closely related, obviously the nerve sends pain messages up to the brain. So every time you feel that tendon and you feel the pain, a message is going up from the tendon to the brain to say pain, 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 pain. Now, over a period of time, 3 months, the brain starts to go, okay, I get it, we're feeling pain. And what you get are biochemical changes in the brain and anatomical changes in the brain, because the brain is adapting to those pain messages that it's getting. And it's going, yeah, I get it. We're feeling pain, I get it. So then what happens, the hypersensitized nervous system, the slightest little touch triggers that pain response. And that's the biggest issue with these tendon problems. If you've had it for 3 months or longer, you have these chronic pain changes. And these have to be reversed. And there are certain things that you can do that will reverse these chronic pain changes. And we start that from day one in the program. We address the nervous system. We address these chronic pain changes from day one. Because if you don't, and that hypersensitized nervous system stays hypersensitized, the slightest little touch is going to trigger that pain response. The slightest little touch is going to switch those muscles on, keep tugging on the tendon. There's no way that tendon can settle down. And this is why tennis elbow can last for years and years and years, because it can. You know, I'm sure you all know people who've suffered for years. And so it's because the hypersensitized nervous system is not calmed down. Now, the session before me was yoga. Yoga can calm the nervous system down. So yoga is a great strategy to use to calm that nervous system down. So if you were on that session, well done. If you weren't, watch the replay and do that session, because yoga, meditation, forest bathing, all of these things can reboot the brain and reverse those changes that we get with chronic pain. So forest bathing, I just briefly mentioned that. It very much sounds woo-woo. And if you told me that I would be teaching these things, you know, when I first started my career, I'd be like, no, I don't do woo-woo. But the medical research is there to back it up. There's a lot of research coming out of Japan about forest bathing. Forest bathing will reverse the biochemical changes in the brain caused by chronic pain. Forest bathing will reverse the anatomical changes in the brain caused by chronic pain. And so getting out into nature, exercising every day. And so I tell my clients, you know, 30 minutes cardio exercise every single day outside, seeing green things is what you need to be doing, because we need to reboot the brain. We have to calm that nervous system down. And these things will do that. So that was a very long answer, Gabriella, but I hope that helps.
No, that was a great answer. Appreciate it. Let's see. We have questions streaming in, which is cool. Mike, do you have to rest to get rid of golfer's elbow?
Great question. So basically, golfer's elbow and tennis elbow, you know, I can say either, and essentially it's interchangeable, because most of the strategies for getting rid of tennis elbow absolutely apply to golfer's elbow as well. The only difference is one stretch and one strengthening exercise we do slightly differently, just because of the different the different place of the anatomy. That's all it is. So for getting rid of tennis elbow or golfer's elbow, you want to take the tension off the tendon. Every time you feel the tendon, it's irritating the tendon. So to heal the fastest, you need to not feel pain. So you can do whatever you like that doesn't hurt. But if something is hurting it, it is going to take longer for that tendon to settle down.
Gotcha. Awesome. Thanks.
Helps, yeah.
No, definitely. Let's see. Dr. Nordstrom again. Oh yeah, sorry, I read that one. Thank you, Tom, though. Yeah, this is a great one. So I heard, so for context, Jeff Greenwald, I believe, mentioned that he had tennis elbow and he used shockwave therapy, and he mentioned, you know, after I think 3 sessions that it went away. So I'm curious, and I think you were on that session too, actually, Emma.
I was, yeah.
I don't know if you were there when you heard that, but I was really curious. So do you have any thoughts on shockwave therapy?
Yeah, absolutely. So again, going back to the beginning of the presentation, talking about symptom resolution versus healing the tendon. So Jeff mentioned yesterday he'd had shockwave therapy, and he'd had, I think, like you say, maybe on 3 to 4 sessions, and it eliminated his pain. And that's great. That's symptom resolution. The tendon takes 12 months to heal, and it needs an eccentric load to go through it in order for the tendon to heal. So there are certain things that you can do for symptom resolution. And I've heard some people will just like, I'm just going to avoid everything. They rest and they don't do anything, and their pain goes away, but that's not healed. It's symptom resolution. So they've got rid of the symptoms, but they're not playing tennis. They're not picking groceries up. They're probably not taking the milk out of the fridge even, but they're keeping themselves comfortable. So symptom resolution is a big part of healing. Obviously, everybody wants to be pain-free, but in order to heal the tendon, you have to put the eccentric load through the tendon for it to fully heal. Now, I would say things like shockwave therapy, PRP, there's definitely every now and again something will come out that like, this is the new thing. Like PRP a few years ago, that was the new thing for tendons, and it hasn't kind of panned out. I've seen people who've had PRP, and obviously I've seen people who haven't had PRP. They do the same. So I don't see any difference in the people who've had it versus the people that don't. What we do know now, though, again, from more recent research, is that when you stick a needle into a tendon, it's detrimental to the tendon. So my advice is not to stick needles in tendons. Shockwave therapy. So PRP and shockwave therapy are not covered by insurance. The reason things are not covered by insurance is because the medical evidence is not there to support it. And so if you wanted to try it for symptom resolution, I would say absolutely. And the good thing is, as Jeff mentioned yesterday, 3 to 4 sessions is all you need. So it's not something that you would need to go and sign up for 20 sessions or go and have it for, every week for 6 months, because it doesn't work like that. If you go and you have 3 to 4 sessions and you get symptom resolution, that is great. And then add in the other exercises that you need to heal the tendon, and you'll be well on your way to getting rid of this forever. If you don't heal the tendon, if you get symptom resolution, you feel better, the pain is gone, the tendon's not healed, it's going to come back. And that's what sometimes happens is people have this episodic, well, I get it, and then I feel better. And then it comes back again, and then it feels better. And so to get rid of it completely, you need the eccentric loading. But if you do want to go and try it, like I say, I heard Jeff's session yesterday, and he had great relief after 3 to 4 sessions. Do not do any more than that. Don't be spending your money on a ton of sessions, because if it's not working, it's not working. The research shows that about 65% of people can get some relief of symptoms, and not all of them will be pain-free, but it will be a reduction. But know that 3 to 4 sessions is all you should be going for.
Gotcha. So I guess essentially, like, it's worth it if it like hurts a lot, then you get the treatment, and then then you'd like go on with the actual exercises you need. Otherwise, not worth it, I guess. Yeah, very cool though. Very cool. Let's see, Susan. Oh yeah, we saw Susan's comment. Thank you.
Thank you. Nice
Let's see. Yeah, definitely. Dory, I noticed that my elbow cracks when I do the bicep exercise. What's up with that?
Yeah, all joints click and crunch and crack. So it can be different things can cause different sounds around our body. So for me, every time I do push-ups, my elbows will crack. And it's the way I'm made. It's always done that. Doesn't bother me, doesn't hurt me, so I don't worry about it. In fact, my mother actually took me to the doctors about it when I was a kid and made me do push-ups in the doctor's office. So
nice.
he could hear my elbows. And he was like, "You're completely fine." So all joints click and crunch and crack. So it can be, when you kind of like crack your knuckles, or you crack your back or your neck, and you feel that release. That can be gas being forced out of the fluid within the joint, and then it doesn't do it for a little while the gas reabsorbs into the fluid again, and then you can crack it again. So that's kind of like cracking your knuckles. Soft tissues can crack. So if it's kind of going crack, 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 that's not the gas being forced out of the fluid. That's more likely to be a soft tissue that's flicking over, either a bony point or something like that. And again, if it doesn't hurt, we don't worry about it. Now, would I want you doing 100 of those a day if something's flicking over something? Probably not. So if it's not comfortable, you need to change it. But if it's not bothering you, don't worry about it.
Got it. Awesome. Let's see what else we got. Oh, and sorry, I forgot to ask you, Emma. I mean, is it all right to keep doing questions, or did you want to like keep going with anything, or are you all good?
Yeah, I'm happy to go through the questions and then we'll get on to the shoulder stuff. Yeah.
Okay, sure. Great. Let's see, Gabriella. Tennis rackets. Does it matter where the weight of the racket is for tennis elbow prevention?
Yeah, absolutely. Yeah, for sure. You know, you want to look at how much tension are you generating in the forearm muscles? Because when the forearm muscles are working, that's when it's going to be tugging on the tendon. And that's why when we introduce the eccentric exercises, we have to get heavy with those. This is a really great point because I've not talked about this. Heavy load eccentric exercises are basically what gets rid of a tendon problem or heals a tendon problem. And I've spoken to a number of people who had really been very successful with their rehab. They had gone through physical therapy elsewhere, had got symptom resolution, were doing eccentrics, were completely fine day to day. The only thing they couldn't do was get back on court. They just couldn't play. And when I asked them how heavy their eccentric exercises were, 2 or 3 pounds. And that literally was the only thing missing. They just weren't heavy enough. And so when you're looking at the amount of force that's generated in the muscles, those muscles need to be strong enough to be able to take that force and to be able to deliver that force and to be able to basically cope with it. Essentially, if the muscle is weak, that stress and strain is going to go through the tendon. And so that's why we have to build the muscles up. If the muscles are strong, the muscles can tolerate that. The tendon is going to be happy because there's no abnormal stress and strain going through the tendon because the muscles are doing the job they're supposed to do. So when you're looking at weight, you definitely, the heavier something is, the harder the muscles have to work, for sure. And so when I'm rehabbing people to get back onto court, generally when people are going through the program, when they get somewhere between 5 and 8 pounds doing the eccentric exercises, they're pretty comfortable day-to-day activities. When we're between 8 and 12 pounds, they're pretty comfortable doing more moderate intensity activities. So, things are a little harder. But really to get back on court, you're looking at 12 pounds plus. So unless you're doing eccentric exercises with sort of 12 pounds plus, you're likely not strong enough in the forearm muscles to be able to tolerate that. But weight of the racket will absolutely play an influence on that too, for sure.
Awesome. Super interesting. Let's maybe take one more if you don't mind, then we'll go on to the shoulder portion. Perfect. Gordon Tanner, why does gut string make such a difference to tennis elbow? It cured my elbow issues.
Yeah, great question. And again, likely it was symptom resolution. So I would still advise you to be doing the eccentric exercises just to make sure you fully heal that tendon, because you want to make sure that you do. But if you think about it, it's all down to force production. It is basically physics. It's how much force is going through the racket and then being generated up your arm to the elbow. So how much force is being absorbed by the racket? How much force is being transmitted through to your arm? That's basically what it is. And if you were able to settle your symptoms down, that is perfect. But I definitely advise you to do the eccentric exercises just to make sure you fully heal that tendon and it's never going to come back.
Got it. Beautiful. Well, Emma, I'll let you go on, and then we still have a bunch of questions. We'll try to fit them in later.
Sure. Yeah, no problem at all. So,
Great.
as you've heard, sort of like the song, the elbow bone's connected to the wrist bone and the shoulder's connected, and it is. Everything's connected, which is why when I work with people, we do core exercises, we do neck strengthening exercises, we do shoulder strengthening exercises, because if any portion of that chain is weak, if there's any weakness in the chain, it can then lead on to issues like tennis elbow. So I always address everything else. And it's common to see shoulder impingement, as Gabriella mentioned earlier, shoulder impingement as a precursor to tennis elbow. And it's for that reason, because the brain is basically saying, oh, there's an injury here. I don't want to make that worse. I want to take the stress and strain away from that. Takes the stress and strain away from there. That stress and strain goes elsewhere. And that's when we flare something up. Then we get the hypersensitized nervous system and it just goes, oh, and so we have to bring all of that down. So when we're looking at shoulders, there are 3 specific things that we need to look at. We need to look at the position of the shoulder. And conveniently enough, I have my bones here. So this obviously, if your shoulder looks like this, that's not a good situation. But it serves the purpose because I can show you what I mean. So this is your shoulder blade. So that is going to be kind of like at the back of the shoulder there. And then obviously this is the top part of the arm bone. So normally that's how your shoulder looks. Okay. So obviously as you're moving your arm, can you see that? As you're moving your arm, that's how we should get it. Now, what happens in shoulder impingement, you see this bony part of the shoulder blade. It sits right over the top of the top part of the arm bone, the head of the humerus. And when this arm comes up, say, for example, when you're serving, things like that, that arm is going to come up. If the shoulder blade doesn't get out of the way, can you see how it basically bumps into it? And that's shoulder impingement in a nutshell. So that's a shoulder impingement. So what we need to happen is for the shoulder blade to move out of the way as the arm goes up, and then nothing bumps into each other. So the muscles that do that, so there's a couple of things we need to look at here, is what's happening at the front to pull the shoulders into this position, sitting on your laptop, on your phone. So, so much of daily life takes us into this kind of position where our shoulders are forwards. So stretching out through the front part of the shoulder is going to help to keep you in a good position. But essentially, we really need to look at the muscles that stabilize that shoulder blade, and they're the lower traps. So trapezius is a big triangular muscle. It attaches to the back of your head, the back of your shoulder, and the middle of your back. So if you imagine a triangle connecting those 3 points, so base of your skull, back of your shoulder, middle of your back, that's trapezius. The upper fibers of your trapezius, these are our stress muscles. 10 minutes in traffic, they jump up. If you're feeling pain, these will be tight as well. And so these tend to be very quick to jump in, tend to be a little bit, I just want to work all the time. And what happens is because the upper fibers are working so much, the lower fibers kind of go, I'm going to switch off. The lower fibers of the trapezius from kind of the mid-back to the back of your shoulder control the position of your shoulder blade. So if we start to get weakness in the lower fibers of the trapezius, that shoulder blade is not going to move out of the way when you take your arm up, and you'll get shoulder impingement. So exercises to strengthen the lower fibers of the trapezius are essential for keeping your shoulder in an optimum position. Now, it is not pulling your shoulders back like this. That would be rhomboids. Rhomboids sit, if you imagine where your shoulder blades are, rhomboids are kind of right in the middle there. They go from your shoulder blades to your spine, and they pinch your shoulder blades together. They're a movement muscle. That's what they do, is they pinch the shoulders together. The lower fibers of the trapezius, see that difference when I do that? This is rhomboids. This is lower fibers of trapezius. That's the difference. It's very, very subtle. It's almost thinking about shoulder blade going back and down on a diagonal towards the opposite hip. It's a very subtle movement. I'm doing that with my shoulder right now. You can barely even see it, compared to that big pinching back. So that's the subtle difference. Those exercises they set the foundation for the shoulder being in a good position. They're almost like the core exercises. When we think about core exercises, deep abdominal exercises to support your spine. So everybody knows, work your core, it's going to prevent back pain. These lower fibers of the trapezius exercises, basically they're essentially like the core exercises for your back. They are going to take the stress and strain away from the shoulder. They keep the shoulder in an optimum position. They're going to prevent shoulder impingement. So they're really important to do. Now, lots of people know to work their rotator cuff, and you'll see people in the gym doing the bands, rotating with the bands or the cables, or even with weights. They are rotator cuff exercises. However, if you've not set your shoulder blade into its optimum position first before you do that, you could just be grinding underneath that bony arch, and then you're going to just perpetuate the shoulder impingement that you have. So it's essential that we get the shoulder blade in the right position, shoulders in its optimum position, then we're going to work the rotator cuff. So that's the way that you're going to avoid any kind of shoulder impingement issues. That's the way you're going to treat it. So if you have any shoulder pain, it's a lot of times shoulder impingement is the biggest cause of that in overhead athletes. And that's the way you're going to get rid of it, by doing those lower fibers of trapezius exercises. Now, for everybody who is on live today, I am going to give you a free mini course that has these exercises in there. You've got the videos in there. There's the stretch for the pecs. There is the lower fibers of the trapezius exercise and rotator cuff exercises. So you can sign up for that course. You need to put in the coupon code Tennis Summit. Put in that coupon code Tennis Summit. You get that course for free for everybody who's on live. Yeah, you are absolutely welcome.
That's so nice. And do you want me to put anything in the chat, or how would you like to do it? Because I see the sheet you sent, but
yeah. So I mean, if you want to put the link in the chat, or there is a QR code. I don't know. Can you pull the QR code?
Yeah, for sure. Let me.
Sorry.
Let me share my screen. Just give me 1 second. And
yeah, no problem.
All right, perfect. Yeah, thanks so much, Emma. That's really cool of you. So yeah, basically here it is. So I would encourage everyone to let me see if I can full screen this actually. But yeah, basically just put your phone in front of it, and then
click on there.
It'll pop in, and then use coupon code Tennis Summit, right?
Tennis Summit. Make sure you use that coupon code. You get it for free, and it'll give you an option to subscribe to my email list on there as well. If you want to get more sort of weekly hints and tips, feel free to do that. You don't have to, but you'll get the course for free if you put in the coupon code Tennis Summit.
Yeah, that is super nice of you. Thank you so much, Emma. That's
so
brilliant.
Welcome.
Yeah, awesome. I guess I'll take it off for now, and then we will put it back later. But yeah. Awesome. Thanks. Let's see. Oh, sorry. Did you have anything else on the shoulder before we take questions?
I'd be happy to take questions.
Okay, awesome. I might go in reverse, y'all, because I saw some shoulder questions towards the end, and I'll go back. But
okay.
Yeah. Oh, Susanna says, "Did it? Thank you." Yeah. That's, again, super nice.
Glad it worked.
Yeah. I checked too. It definitely worked. Technology. It's cool.
I know, right? We love it.
Yeah, definitely. Usually. Jory, again, a great question. When I do the shoulder rolls, I always feel a clicking on my clavicle. What can I do to fix that? Would that contribute to my golfer's elbow on my left arm?
Great question. Yeah, I have a client right now who is getting similar kind of issues. So shoulder rolls, up, round, and back, really lovely exercise to do. It's one of my favorites. But you're getting a big movement of the whole of the shoulder girdle complex. And what we mean by that is the scapula and the humerus, as we were looking at before, but also the collarbone as well, because that attaches to the part of the scapula as well. When you go up, round, and back, you've got joints. You've got a joint right at the front part here, where the collarbone attaches into your sternum, and then all the way back there, where your collarbone attaches into your shoulder blade, you've got another joint, the acromioclavicular joint. And so both of those joints, as I said before, joints can click and crunch and crack. And when you're doing this, sometimes you can feel that joint clicking, crunching, cracking. If it doesn't hurt, don't worry about it. If it bothers you, we need to change it. So the client that I was working with had a little bit of arthritis, or a little bit of OA in the front part of where the collarbone attaches into the sternum. So we changed shoulder rolls just into shoulder shrugs. So up and down he could tolerate, but up, round, and back he couldn't. Could it be affecting golfer's elbow? I mean, everything is connected. So for sure, the way that you're moving sort of up here is absolutely going to affect the arm lower down. I would look at whether that shoulder shrug is perhaps just more comfortable rather than doing the full shoulder roll. Try that, Dory.
Awesome. Very cool. Let's see. Sorry. So we got the shockwave question. And then, so John, elbow compression straps seem to provide some relief, temporary relief from the pain under load. Do they delay healing?
Great question.
Yeah.
So yes is the short answer. When you put anything external on, and so those straps that you put below the tendon, they go around the muscle basically as tight as you can be without your hand going blue or tingling. They do take the tension off the tendon, absolutely. But because you've put them around the muscle and you've got something firm around the muscles underneath switch off. And so ultimately we're trying to build up the strength in the muscles because the muscles should be taking the load, not the tendon. And so when you put that strap on, it's going to weaken the muscles underneath. So I don't advise using the strap unless sometimes people will be moving house and they know they're going to be like loading boxes, picking up boxes. I'm like, you know what, if you need to wear the strap just to get you through moving house, let's do that. Or sometimes people need it to work. It's not ideal. I was working with a sushi chef. He was chopping sushi all day long. And, so he needed to wear it while he was working. But then we'd say, okay, if you are physically chopping, you wear it. The rest of the time, you like loosen it, take it off. But do I advise it to play? No, it's just going to take you longer to heal. It's better to not wear it and get better faster and just get back on playing normally. That is the ideal. But great question.
Cool. Great. Yeah, we got a couple questions about the coupon code, but I told them to try, all caps, one word. I think maybe they might have been putting 2 words. So very cool. Let's see, Brendan, I have also found that hanging from a bar has helped both my shoulder strength and a tennis elbow. I'm almost pain-free now.
Fabulous. So you're getting a really nice stretch through all of the soft tissues. And one of the biggest problems with tennis elbow, or I suppose anything really, is muscle tension. Because when we feel pain, the muscles get tight. When the muscles are tight, they're going to pull on the tendon more, then you're going to feel more pain. And it's that vicious cycle that just keeps going on. When you bring muscle tension down, and stretching does that, you are releasing the tension on the tendon. It's going to feel better. So you're getting a really nice stretch out. You're bringing muscle tension down. Your symptoms are resolving, heading beautifully in the right direction. You still need the heavy load eccentrics in order to heal the tendon. So, there are so many different ways to get pain relief. And whatever you find works for you. If it's feeling better, you're probably heading in the right direction. But then know that you need to add in the heavy load eccentrics in order to heal that tendon so that the symptoms don't return.
Beautiful. Awesome.
Yeah,
definitely. Great question. Thanks. Let's see, or comment, I guess. Susan, what about dry needling? So a couple individuals had questions about this actually.
Yeah, great question. So dry needling or acupuncture, basically, very, very similar techniques, can be really good at reducing the muscle tension, can be really good at pain relief, symptom resolution. Both will release endorphins, which are your body's own natural painkillers. So you definitely can feel better. It helps to bring the muscle tension down. You can get an increase in circulation to the area with both of those things as well, but they're not going to heal the tendon. You need the heavy load eccentrics in order to heal the tendon. So again, they can be really good for symptom resolution. The nice thing about dry needling, similar to shockwave therapy, is that you're going to know within 3 to 4 sessions whether it's working for you, because not everything works for everybody when you're talking about symptom resolution. So if you wanted to try it 3 to 4 sessions, you should know if it's working for you. Fantastic, keep going. If it's not working for you, stop, move on to something else.
Gotcha. Fantastic. Let's see here. Gabriella, would a TENS machine help increase blood flow? Where would you do it?
Great question. TENS machine is not going to increase blood flow, but it will give you pain relief. So the way a TENS machine works is it works on the nervous system. So remember that hypersensitized nervous system sending all those pain messages. The way a TENS machine works is you get that tingly pins and needles feeling. And what it does, it stops the pain messages from going through. So it's not going to increase blood flow. It's not going to increase healing, but it can give you some pain relief. So if you have one and you're going to use it, you absolutely can do that for pain relief. You're going to use, basically X marks the spot is how you're going to put it on. So if it has, most of them have 2 leads with 2 pads on the end of each lead. So 4 pads in total. One lead is going to go above and below one way of the, so imagine the tendon is right in the middle. You're going above and below the tendon. The other lead is going to go sort of at the back and at the front. So almost like X marks the spot. So one set of leads, the other set of leads, X marks the spot, tendon's right in the middle.
Gotcha. Awesome. Let's see. So many questions, which is great.
Good,
yeah, Susanna, do you think Pilates is good for strengthening and for preventative work while also calming the nervous system? I have not tried it, but am curious.
Yeah, it definitely can be. I teach mat Pilates, which I would advise you to start with. You know, the machines are so fun, the reformers and everything. It's a lot of fun, but you need the basics first. It is a great way. It's a really good core strengthening exercise. It's really good for postural awareness. Having said that, to calm the nervous system, yoga, meditation, and forest bathing are going to be more effective. So it kind of depends what you're looking at. You know, maybe yoga, if you're looking for all of those things, would be a better option to start with.
Excellent. Let's see. We've got interesting questions. They are really good questions.
Yeah, love them.
Same. We're learning a lot here. Gabriella, ice versus heat. When I try to do some light exercises, then I feel it feels sore the next day. Maybe I put ice and it feels worse. Although I think it may help inflammation. What would you do and when?
Oh, great question. Love this, Gabriella. Thank you for bringing it up. So ice is really good at decreasing inflammation. Inflammation is only going to occur right at the beginning of an injury. So if you've been feeling your elbow for 3 days or less, get some ice on it. Most people who find me have been feeling their elbow for much, much longer than that. So, you know, really, so I advocate heat. Is basically my answer. The reason for that is heat is going to bring down the muscle tension. And we know that muscle tension is the biggest issue in tennis elbow once it's been going on for a while. Now, you can irritate it, you know, if you've had it for a few months, but then you went out to play or you went and did yard work for 3 hours or something and you were like, oh, I've really irritated it. You can ice it for 3 days because you can get an acute on top of chronic. So anything acute, anything fresh, anything new needs that ice. Anything where there's swelling, ice is going to be your go-to. Anything that feels hot to touch, you're going to put ice on. So any of those things happen, go with the ice for sure. Everything else tends to be heat. So we want to get heat into the muscles to relax them off. Heat tends to do that better than ice. We want to get heat on the tendon because it increases the circulation to the tendon, can help to kickstart the healing process. Heat tends to do that better than the ice. So if you've suffered for a while and it's just kind of chronic, ongoing, switch to the heat and heat as much as possible. So I used to say to people, heat 2 or 3 times a day, that should be fine. But then I had 2 clients completely independently of each other because one was here and one was in the UK. They both heated way more than I told them to, and they both got better faster. And I was like, oh, look at this. So now I tell people to heat every hour through the day. So Gabriella, if you can go and get heat on right now while we're here, that would be perfect.
Yeah, definitely do that. Let's see. Susanna, wow, this is very useful. Awesome. I am struggling with a pulled lower trap, which happened while serving. I can feel it when I breathe. Wow. How do I heal this?
Yeah, that's definitely when you feel it when you're breathing, you kind of know it's being affected every time you breathe. You're not going to stop breathing. Don't do that. It depends when you did it. If it's within the first, probably the first 3 weeks there or thereabouts, ice, see how the ice feels on it. If it's beyond that, then you can do heat, or you might even want to do a little bit of both. Sometimes a little contrast can be helpful in this because we're talking muscle now, we're not talking tendon. And so muscles tend to have a good blood supply. So they tend to have a really good blood flow. So keeping yourself comfortable, heat and ice, try whichever, see whichever feels best for you and stick with it. It might be different at different times, and that's okay too. Gentle stretches. You might find, okay, maybe when I turn, I feel it a little bit. Maybe I need to kind of rotate. Maybe I need to do a little bit of both. Sometimes you need to search for the best stretch, and that's okay too, but keep it comfortable. And I should have mentioned this before when we were talking about stretches. Stretches should always be comfortable. If you're stretching and you're like, that's not okay. Anything that changes the face is not okay. So you always want to be very comfortable when you're doing any exercises and any stretches. So gentle stretching it out is going to be helpful as well, Susanna. But then once you start to feel comfortable doing the lower traps exercise that we were talking about for the shoulders, that's going to help to rehab it and strengthen it back up so that you won't have any issues with it.
Perfect. So Kale asked, can you recap some of the essential muscle exercises for the tennis elbow specifically? I missed that. So I guess I would note that you can rewind the video and find them. So I don't know if, we could just do that probably. I don't know if you want to go through it. Yeah. So that'd be better. Just in the interest of time, Kale, just rewind and you can replay it. So let's see, Susan, I'm in her online Pilates class and I feel so much better. Thanks, Emma. Nice.
Aww, yeah, you're so welcome.
Yeah, Susan's great. Ronald, what is your thought on the value? Oh yeah, sorry, we talked about shockwave therapy. For chronic golfers, sounds like the same thing, right? Just
sure.
All the same. Yeah. So just rewind as well, Ronald, if you didn't hear about that, because we just said maybe 20 minutes ago or so. Let's see. If time, an explanation or demo of 12-pound eccentric elbow exercise.
Yes. So we don't dive straight in at 12 pounds. And the reason for that is you've got to allow the wrist and hand to get used to doing the exercises. So going back to the nervous system being involved, and again, I didn't cover this, so thank you for bringing it up. So when we have this hypersensitized nervous system, it's really easy to irritate other tendons. And that's why sometimes people can get tennis elbow, and then they've got golfer's elbow. Or they've got tennis elbow, and then they've got tennis elbow. Or they get something down in their thumb, or they get something up in their shoulder. I know people who have had tendons affected in their knees and around their feet from a tennis elbow. That was the initial injury. So remember that pebble in the pond, ripples going out. Over time, it can affect other things. So the reason we slowly build up our eccentrics is because it's very easy to flare up other tendons. Now, when we're doing eccentrics, so I teach people with, 2 pound weight. Some people I even start with no weight, and then 1 pound, 2 pound, 3 pound. We go up pound by pound sequentially, or if you are anywhere else, half a kilo by half a kilo by half a kilo. We go up very, very sequentially. I used to say to people, try a can of beans or a bottle of water. And the problem with that is that when you're holding it, the diameter is bigger. You're going to flare up this tendon in your thumb. And the reason I know that is because I did it to people. And it's because the nervous system is hypersensitized. Because the nervous system is hypersensitized, you can flare up other tendons. So it has to be a dumbbell. And it has to be that you can comfortably wrap your fingers around it. As long as your fingers and your thumbs are touching, you're kind of in a good resting position. Anything where you're more wider like this, you're going to flare up tendons. So we start easy, and we start with maximum 3 pounds. Even if you are like Mr. Universe, you would start with 3 pounds because we don't want to flare up other tendons. And slowly over time, we go 3 to 4 to 5 to 6 to 7 to 8. It's the same exercise, but you're going to do, and the reps and sets stay the same. So we build up to 3 sets of 15 twice a day, no days off. And you don't need to do more. You don't get better faster if you do more. That's kind of the optimum. But 3 sets of 15 twice a day, every single day, no days off. And the way that you're going to do that is you're going to rest your arm on a table so that your hand and wrist is over the edge. Again, in the book bonuses, you see the video of this, and you've got that whole explanation. But the wrist exercise, kind of the wrist curl exercise that I'm sure you've seen, I'll do it with the weight, is like the up and down, up and down, up and down. That's how you're going to do that. The problem with that is the concentric portion, the up, irritates the tendon. The lowering down is what we want. So people are irritating, helping, and they don't get better. So you have to use your other hand to lift up, take the strain and lower it down. I mean, it is as simple as doing that. But it's essential to be in a good position as well, because you're going to get heavy. We want the weight to be close to your center of gravity, which is your belly button. Because if you are, and again, I used to teach it on the arm of a chair, and people would be on the arm of the chair kind of doing the exercise. Can you see how my spine is twisted? So people would come back and say, my elbow feels great, but my back is killing me. I'm like, oh no, I flared something else up. So making sure that the weight is right by your belly button when you're doing these exercises ensures that you stay nice and symmetrical. You're not going to put any strain through your back. You're not going to then have to rehab a back issue too.
Perfect. So, Emma, I know that we're past one, so I should have checked with you earlier, but like, you're okay? Okay, yeah. Great. So yeah, I'm good till like, 2 or maybe a little before for our next live stream. Yeah, no, well, we won't go that long.
I can keep talking.
Yeah. Well, maybe we will then. Right. Yeah. Got a fun one on strings and rackets at 2:00 with Richard Groneveld. So let's see. Oh gosh, where was I? So we did the shockwave. Sorry.
That's okay.
Yeah. Oh, so this one's an interesting. I mean, I know we're on the subject of tennis elbow. So do you have any thoughts on this? I mean, I can talk about like what I went through, but I'm not an expert on it. But I mean, do you have any thoughts on that or?
Yeah, and Susanna, like, just you're joking there saying you sound like a wreck, but remember that pebble dropping in the pond and the ripples going out over time. So once you've got this hypersensitized nervous system, it's really easy to flare other things up. And so it could definitely be associated, if you've got an elbow issue or a shoulder issue or something else, it's not uncommon to get these other things going on as well. So for plantar fasciitis, ideally to start with, you can roll on a frozen bottle of water. That can kind of be quite nice to decrease pain. End of the day, a lot of people find that they really like that. But then stretching out, taking that first toe and stretching that first toe is going to be an important way to do that. And there are different ways that you can do that. You can either sit, get hold of it and literally stretch it. You can do it against a wall. You can do it on the floor. So my second book, here's my plug, my second book, Get Out of Pain Fast, that's on Amazon. That contains exercises for plantar fasciitis. So if you, it sounds like you might benefit from that one, Susanna, if there's other issues going on. Yeah.
Whoa, super cool. Wow. It's tough to write books, I hear. So, I mean, that's great. Well done. Let's see. Trying to get back to the questions. Interesting one from Vicky is, what about using an infrared sauna and how often, if so?
Yeah, definitely. So we know heat is going to increase circulation. Heat is going to decrease muscle tension. If you have access to infrared sauna, absolutely. And you could use that every day if you have that access. If it's at a gym that you go to, use it when you're there. That's completely fine. You don't have to go out and buy this. It's not something that I say, if in order to heal, you have to have this. But if you have access to it, absolutely use it. Yeah, no problem.
Nice. Awesome. Some nice comments as well. You're awesome. Thank you.
You're welcome.
Love that. Ronald, awesome. John Ron, thank you. And
I agree.
All credit to Emma here. Let's see. So we have a couple more. Oh, yeah. What about using TheraBars for the eccentric loads? They look like giant pieces of twisted licorice that you twist, from John.
Yeah. I know exactly what you mean, John. Yeah. I do not recommend those because the amount you have to grip in order to use them to get the desired effect is detrimental to the tendon. So it's a little bit like the up and down exercise. You're hurting it, you're not hurting it. You're hurting it, you're not hurting it. When you grip, you're hurting it. and then you're trying to get that good effect, and then you're gripping. So it's the same thing as kind of doing the wrong way of the exercises, if you see what I mean. Any gripping motion is going to be detrimental to a tennis elbow.
Gotcha. And so Vicky asks, please post the book scan again. So I'm just going to bring that up. And then you can actually pause this, pause the video right now if you'd like, if you need the time to, and then just like scan it. So we just put it in here.
So this is for the shoulder course. You get the mini shoulder course. And if you upgrade to the VIP pass, you get the book.
Yeah, exactly. I'm going to actually post that in the comments right now as well. So there you go. All right, gonna remove this and probably we might put it back on later. Okay, let's see. Glenn says graduated increments of contraction explanation.
Oh, a thumbs up to the graduated increment.
Oh yeah, sorry, thumbs up. Yeah, that's right. Yeah, thank you. Thanks, Glenn. Suzanne, amazing. I'm now a fan. Love it. Yay. Love it. Suzanne, how about massage? If so, is using the Theragun okay?
Great question. Yes. So my program is basically split up into 4 phases. Phase 1 is all about a lot of these symptom resolution strategies that we're talking about. Phase 2 is about normalizing the muscle tension. Phase 3 is the strengthening, and phase 4 is building up endurance and function, getting you back on court, getting you back playing. So massage is a phase 2 strategy. Soft tissue techniques, they bring the muscle tension down. So yes, it's very important. It can be really, really helpful. Using a Theragun can be okay as long as it feels okay to you. For some people, doing it on this part of their body, because you wouldn't do it over the tendon, you're just going to do it through the muscle. For some people, it's just it's too tender an area, or the Theragun just feels too strong in that area for some people. If it feels okay to you, that's completely fine. You absolutely can use it. I teach people trigger pointing in there to get rid of some of the trigger points, soft tissue massage. You can roll, I'll say a rolling pin, because again, foam roller is great for like your thighs and glutes and things like that. You can use a foam roller on your forearm, but you can use a rolling pin from your kitchen, something really, really simple. If a Theragun feels okay, you're absolutely fine to use it, but sequence it. So you would do the heat first, then you would do your soft tissue techniques like we've just been talking about, and then you're going to stretch. That's going to be the most effective sequence for bringing the muscle tension down and feeling better.
Love it. Thanks, Emma. Great question. Susanna, why are resistance bands not good for eccentric work for elbow?
These are such good questions. I love them. Essentially because most of the time you have to hold on to a resistance band, and so you're gripping, so that's not going to be good for the tendon. And the other thing is they don't give enough resistance. For you to be able to play tennis, you're going to be getting up to 12 pounds doing the eccentric exercises. The resistance bands don't give enough resistance to allow you to get to that level.
Gotcha. Makes sense. And let's see, Bruce says, much thanks, Emma and Mirban. Pleasure. No problem. All right. So I guess at this point, I don't see any other new questions. I mean, I guess any, final thoughts in terms of just, shoulder weakness, tennis elbow, next steps for people to follow?
Yeah, absolutely. I think the number one thing that I would say is that tennis elbow is 100% resolvable. It really is. I've spent the last almost 15 years now helping people with tennis elbow, and I'm starting to look into more prevention from sort of kids and up. So looking at working with kids to start adding in these stretches so that they start doing them without even thinking about it. It's becoming a habit so that we can prevent people developing tennis elbow sort of in the future. But know that it's 100% reversible as long as you're doing the right things. Recognize that there are kind of 2 aspects to it. We've got symptom resolution, and becoming pain-free is obviously the number one issue, the number one goal of everybody to start with. But know that you've then got to heal the tendon, and know that it will take 12 months to heal the tendon, and know that you need to do those eccentric exercises for 12 months. But if you do that, the tendon is going to heal, and there's no reason why that tendon should ever be an issue for you again.
Awesome. Love that. Yeah, such great advice. I guess we can sneak another question that we got in, if you don't mind. Dory, I like to apply heat before I do eccentric exercises and then do trigger point and pointing and stretching. Is that okay?
Absolutely. Yeah, absolutely. You're basically bringing the muscle tension down. And so it's always essential to bring the muscle tension down after the eccentrics, which is why we stretch after each set of the eccentric. So we do 15 reps, stretch, 15 reps, stretch, 15 reps, stretch. We always finish with a stretch. So we're bringing the muscle tension down because we know the muscle tension is going to go up with the eccentrics. We're going to bring it down with the stretch. If you want to, or if you need to bring the muscle tension down before you start them, absolutely fine. And you definitely can use that sequence. Heat, soft tissue techniques, stretches if you need to, then do them. That's perfect.
Awesome. Good stuff. Let's see, Tom. Prevention is the key to avoid getting tennis elbow with the same routine that Emma advocates. Love it. That's right.
Thanks, Tom.
That's right. So cool. Well, looking, I don't see anything else new at the moment. So I just want to highly encourage everybody to take advantage of the really kind, bonuses that Emma has for us, including, and I put the link in the chat. So just scroll up a bit. It's like probably 2 messages up, where Emma will give her book free to everybody who signs up for the VIP pass through Emma's link. That's so cool. I personally love books. I love them much more than like Kindle, type electronic books, because I can, I feel it in my hand, read it, mark it up. I really love that. That's right. Yeah, that's right.
That's it. The smell
right
of a book too, isn't it? Like,
yeah.
You've got so much good stuff in there.
Yeah. So awesome. So yeah, what a great bonus there. Really appreciate that, Emma. And then also, again, take advantage of the Shield Your Shoulders mini course for showing up to this live stream. And you can just scan this QR code here. And I've also, put in a link as well for some of you, I think on mobile, who can't, I guess, scan your own phone since you're watching it on there, which makes sense. Yeah. And then also, I guess, do you want me to put the link in here in the chat for the Calendly bookings as well?
Sure. Yeah. If anybody is struggling and would like to speak with me, feel free to set up a free 30-minute consultation. More than happy to talk to any of you guys about any issues. Obviously, tennis elbow is what I treat, but that's how people find me. But if you have other issues that you'd like to discuss, more than happy to talk about that too. So feel free to book in a session.
Wonderful. Yeah, I've put all the links pretty much now, the Calendly book booking link as well in the chat, and tenniselbowqueen.com. And then let's see. Sorry, a couple more. Dory says, Emma's program works. I had golfers in tennis elbow and I'm playing again. Raise the roof. That's right. Good job. Great
awesome,
job.
Dory. You've done so well.
That's amazing. And then Susanna says, can you go back and play if there's still some pain? Good question.
Yeah, great question. Again, just to reiterate that if you're feeling it, it is irritating it. And so ideally, you want to keep yourself 100% pain-free. And it's not forever, it's just for now. And so there are things that I utilize. So for example, in phase 1, we utilize visualization. So we want to keep the neural pathways strong. So we use a lot of visualization of you doing certain shots, of really immersing yourself into the thing that you're imagining. And so we're keeping the neural pathways strong, but we're not irritating the tendon. And as we go into phase 2, we start introducing sport-specific movements. We start introducing sport-specific exercises that, again, keep those neural pathways strong. So even if you are not able to play because it hurts when you hit the ball, you're able to do a lot of the other stuff that will mean that once that tendon is healed to the point where it's able to tolerate that, you can then hit the ground running.
Yeah, awesome. Great advice. Cool. Well, I guess that's it for now, unless someone sneaks in a question in the next 10 seconds. But yeah, I just want to thank Emma so much for doing this live session. It was great, and we had an outpouring of questions, so that was so cool. Great questions, everybody. Great to learn all these different aspects of how you can prevent and also treat tennis elbow, and really the connection between shoulder weakness and tennis elbow. And like we said, if you want to be able to refer to this lesson as well as the 40 plus other ones that we did, including like I think 16 live streams total. And then also get Emma's awesome book as well on tennis elbow, which she has on screen. Yeah, tennis elbow relief. Then definitely check out the link that I put in the chat. So you just click on that to get the all access pass, and then Emma will hook you up with her
I'll send you the book.
Yeah, yeah. So definitely want to do that, and check out all of our great content as well with the links that we put in. Tennis Elbow Queen and the Calendly link as well to chat with Emma. So yeah, Emma, thank you so much for. Oh, we got another question.
I love it. I love it.
Oh, that's good. That's good. You got me. Susanna, do you follow the same process for muscles?
Great question. So muscles are going to heal faster because they have a much better circulation. If you tear a muscle or you pull a muscle, you get a big influx of blood to that area that brings the building blocks for the healing process that the muscles need. So they do heal much faster. The 4 phases would absolutely be the same. Looking at symptom resolution, looking at reducing muscle tension, looking at strengthening, and then building endurance and function, getting you back on court. But it happens much, much faster with muscles than it does with tendons.
Gotcha. Cool. All right. I think it might be the end. We'll see another 10 seconds. But yeah, Emma, thanks so much for this session. Everyone check the links in the comments. And yeah, I really appreciate you all joining. And we have another live stream session, the last of today, at 2 p.m. Eastern time with Richard Groneveld on tennis strings and rackets, how to choose the best ones for you and mistakes that people commonly make when choosing them. So Emma, thanks a lot for all your great work, and looking forward to next time.
Yeah, you're so welcome.
Oh, no problem. And a couple other comments. Susanna, thank you. And then interesting, Cliff, I know it's a different subject, but do you provide a strategy for fibromyalgia?
Yeah, great question. So a lot of the strategies that I use to help calm the nervous system can be very helpful for fibromyalgia as well. So yeah, I would recommend following the phase 1 strategies. If you get the book, that has all the phase 1 strategies in it. In fact, even if you get this book as well, this has all of the phase 1 strategies in. This one covers exercises for the whole of the body, whereas obviously the tennis elbow book is specific for tennis elbow. This has back, neck, knee, elbow, foot, hand, everything in it. But the phase 1 strategies are going to be the same because they're working on just calming the nervous system. So yeah. Yeah, great question about collagen and krill. And kind of the jury is still out with regards to any kind of supplements and things like that with regards to tendon healing, where because tendons change so slowly, we don't see supplements being like taken up by the collagen and the connective tissues that are in the tendons because they change so slowly. So it's a really difficult one. I advocate a protein-rich diet because protein is basically how you're going to heal the tendon. And a protein-rich diet, that does not have to be animal protein. It absolutely can be plant protein, which again, the research is showing us is going to be more healthy as we get more and more research about it. But protein at every single meal and snacks, so you're getting just that constant stream of protein going in so that it can help to heal the tendon. But the jury is still out with regards to supplements. Like I say, the evidence is not there that anything gets to the tendon to make it heal faster. That may change in the future, but that's just where we're at right now.
Gotcha. Cool. And Cliff says, thank you for your response.
So welcome.
Good stuff. All right. This could be it possibly, but yeah, I mean, if you have any more questions, obviously you can just check out the Calendly link and book a chat with Emma. So yeah, thank you so much, Emma, and everybody. We'll see you next time. And yeah, have a great weekend.
You're so welcome. Take care. Thanks, Meban. Bye, everyone.
Thank you all. Thanks, Emma.